Yes, sir.
Hi, Senator McCain. My name is Neil Coker. I'm a ED nurse at the Cedar Crest site here. I was when I was coming into work today, I heard on the radio that a high government official said that Medicare was going to be broke in a few years. And my question to you is, when you become president, well, what will you do to overhaul Medicare?
Thank you. Thank you for the question. Secretary of Health and Human Services, former Governor Levitt of Utah, gave a speech yesterday, I believe it was, and I have gotten a copy of it and hadn't had a chance to read it, where he basically talked about the fact that Medicare is going broke. And Americans need straight talk. Americans need straight talk. And that is that the Medicare system in America is not going to be there for the next generation of Americans. And we have an obligation. We have an absolute obligation not to pass on that unacceptable situation to the next generation of Americans. And we're going to have to sit down together, and we're going to have to work it out so that we can get health care, Medicare, for succeeding generations of Americans who are now paying into the system, as you know. I believe that the key to this is not the quality of health care in America. If you forget everything I say today, let me emphasize to you this. The quality of health care in America is the best in the world. That's why when someone who lives in another country who gets ill, they come to the United States of America for treatment, and the ones that can afford to do so. It's the cost of health care. It's the cost of health care that makes it not available to all Americans. And you see this directly affected in the skyrocketing cost of health care, which is then reflected in the skyrocketing costs of Medicare and Medicaid. So we've got to get the costs under control, and that's why I sounded a little repetitive in our discussion about costs. And I think that to say we can't do anything about it ignores coming to this kind of caregiving and loving institution where they obviously not only give a higher quality of care with less errors and far more efficient and saving wonderful young people like Martha, but it also reduces the cost of health care because we cannot afford double-digit or near double-digit escalation of health care costs in America. And we have to have more competition, more transparency, more walk-in clinics, more treatment of people who have a chronic disease. One of the 5 major diseases, if they have that, then you give the caregiver a certain amount of money for that treatment and care. And then at the end of a period of time, you reward that caregiver or not. You want to encourage home health care, which is a much more loving and caring setting than institutionalized care. You want to, I think, increase the availability of a thing called cash and counseling, a program where basically they provide patients with a certain amount of money, and they pay for their caregiving themselves and make their decisions with their family and the help of outside people to give them the advice and counsel they need. Now, many people say that seniors can't do that, but in this experiment, they not only can but do. And frankly, they have been much more cognizant of the costs when the money is given to them than in another way. So there's a lot of common sense solutions to this, but there's not any one solution. So I guess my answer to you is the Secretary of Health and Human Services is right. And I think there's a sense of urgency that we are, I think there's not the sense of urgency that this issue deserves. And I want to tell you right now, I will reach across the aisle to the Democrats, and I will say, and the other party, I will say, look, let's sit down together. Social Security is not going to be there for the next generation, and Medicare is not going to be there for the next generation. Now we have to sit down together and do what the American people want us to do. And I guarantee you it's been done before, and I can do it again. And I thank you for your question.
Thank you, sir.
Yes.